Hello, good evening. Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Welcome to our clinic this evening. Today is the 11th day of April 2023 and it's our popular, regular open clinic with Dr. Chudi. Today's topic is amazing. You don't want to blink and you will miss it. So, we want to find out if pregnancy is still possible, even when you haven't bled. For a young girl, or when you used to bleed and suddenly you stop bleeding. So, can pregnancy happen when you have not experienced your monthly flow for 3 months, for 4 months, for 6 months, for 12 months? What is the likelihood of pregnancy to happen when you are not bleeding? This is the basis for my teaching this evening. And I'm going to give you a chance to come in. Please, when you join, introduce yourself, tell us your name, excuse me, tell us where you're located. And once I have a feel of more people in the clinic, then I'm going to start my presentation. After my presentation, please, you can ask all your questions. Your questions might be related to this topic, or it might be related to other topics. But so long as it's a question related to infertility, definitely you're going to get an answer from me. So thank you so much. I'm so happy to share my knowledge with you guys this evening. So please, when you join, please do me a favor and introduce yourself. Make it very snappy so we can get things started. Okay, thank you so much. So once you join, tell me who you are, tell me where you're located, and I'm going to give you minutes before I start my presentation. It's very interesting. There are so many things that will encourage you this evening to continue believing God for babies. It's not over yet. Okay? All right, we've spent 2 minutes, so I'm going to start. When you're just coming in, just flow with me, and probably you will catch up with me during the question and answer time. So the big question is it possible to become pregnant when you have not bled at all? For a young girl, the answer is yes. Can a virgin become pregnant? The answer is also yes. So a girl can get pregnant even before her first period if she gets exposed to sexual intercourse. Now you have to understand that sexual intercourse has a broad spectrum definition. Anytime you're in close proximity with the opposite sex, it's considered sexual intercourse. Now there are principally two broad-based, classification: penile sexual intercourse and non-penile sexual intercourse. Now a virgin from our culture, it's a lady that probably has not had penile sexual intercourse. But when there is a contact between the penis and the vagina, despite the fact that the penis might not enter the vagina, any fluid that comes from the penis, in cause of touching, caressing, and all that, can get that lady pregnant. So a young girl might not necessarily bleed because in the scheme of things, you are expected to have ovulated. The key in getting pregnant is not bleeding. The key in getting pregnant is ovulation. So a young girl that just started, becoming a woman can ovulate before she bleeds. So within that period she's ovulating, it might actually be the first time she's ovulating and she didn't bleed, she can become pregnant. Even when she did not have penile in penetrative sex, she can become pregnant. So the fact you're not bleeding now, generally to anyone out there, does not rule out the possibility of naturally conceiving and becoming pregnant, even when your period is absent. So remember this: whenever you're in the process of trying to give up, you're down, you're depressed, you feel like it's all over. Ovulating without a period is unlikely, but it's not impossible. It can happen. So while you can get pregnant without your bleeding, I want you to understand one thing this evening. If you know currently you're not bleeding, I don't want you to just pretend and assume that, oh yes, I'm going to become pregnant. Still seek help. But while you're still seeking help, remember you can become pregnant. So, in as much as you can become pregnant without your period, it's unlikely, it's not common. So, matter of fact, if you're not bleeding, it's actually an indication to see a gynecologist, and a gynecologist will refer you to a fertility specialist. Now, there are a couple of things that can lead to your inability to bleed, and you might be pregnant or you might not be pregnant. Breastfeeding. You see, the body of a woman is structured in such a way. Let me see if my teaching model is somewhere here. Correct. So the body of a woman is structured in such a way that there are hormones that regulate all this. So anything that flips the hormones can flip your cycle and confuse your body. Now, when a woman is pregnant, it's expected that everything will change to nurture that baby until the baby is born. When the baby is born, the hormones will start fluctuating. The hormones that will nurture the baby, of which the major one is prolactin, will go up. When your prolactin level goes up, it will lead to what we call milk letdown reflex, which will lead to you producing milk you will use to breastfeed your baby. Now, it's expected that if you're doing exclusive breastfeeding means you are only giving that baby breast milk. It's expected you will have a passive protection from pregnancy called lactational amenorrhea. This can happen. So you need to know all this stuff so that if you happen to find yourself in that situation, you need to take precautionary measures. So what we normally tell women before they go home, before we discharge them, please stay on reliable contraceptives, because you can become pregnant within 2 months of having a new baby. You can become pregnant within 3 months of having a new baby, within 6 months. So it's not common, but it can happen. Now, some women might also be on some medications. Some women might have recently added a lot of body weight or lost a lot of body weight, or they were previously on birth control pill and suddenly they stopped and they think they are still okay. Meanwhile, the period is not coming, because one of the presentations of pregnancy is lack of period. So then when you don't have your period and you're not pregnant, that's what we're talking about. Can pregnancy still happen? Yes. So it's important you understand that if you are not getting your period, it's possible you are not ovulating regularly. Some women will just be skipping their ovulation. January, they will ovulate. February, they will skip. March, they will skip. It doesn't mean you are not ovulating. You can still become pregnant even when you're not bleeding, so long as you're ovulating. So your take home today is to make sure that regardless of what happens, so long as it's not confirmed you've gone into menopause, keep on making love. That's the secret. Don't give up because you have not seen your period since December. You can still get pregnant. You might be among the few who can get pregnant. So if ovulation occurs and you don't conceive, that's actually when you start bleeding in a natural scheme of things. But some women can bleed without ovulating. It's called an ovulatory cycle. So depending on the reason why you're not bleeding, we need to figure it out and begin to seek help early. The end of your menstrual cycle is actually marked with appearance of your bleeding. So in the general scheme of things, when pregnancy happened, there will be no bleeding. But when the egg is released and the egg is not fertilized, the egg will disintegrate and the cover of your womb will disintegrate. It will be part of what will pass out from your body. That's called your bleeding. So your bleeding is the very first day in your cycle and also the last day, depending on how you look at it. So you can ovulate and you might not even know. So there are some factors that will lead to this ability to become pregnant, even when you're not bleeding. I've already mentioned breastfeeding. So when you're breastfeeding, you will have a kind of a confused state in your body because of a lot of hormones in your body. But you can actually ovulate when you're breastfeeding, when your period has not returned and you become pregnant. This is how so many new mothers will be complaining, oh, doc, I don't know what to do. I'm 3 months, my baby is 3 months, and I noticed I'm pregnant. Why? Because they were not using protection. Now, if you use some forms of birth control, when you stop them, they will not necessarily return your body back to previous state. but they can take time. Like if you use a type of contraceptive we call Depo-Provera. Depo-Provera might take about 6 months to be completely washed out from your body. And within that time, it's still in your body. It can make you to not see your period, but you can become pregnant. Now, some women might be on some medications. So besides the birth control pill that can confuse your body, you might be on some psychiatric medications. It might be antidepressants. It might be anxiety drugs. It might be chemotherapy. It might be allergy drugs. It might be blood pressure pills. They can switch your cycle and you might be confused and your period will not be there, but you can become pregnant. If you recently noticed that your BMI is above 30, you are obese, you have obesity. Obesity is also a cause of infertility. So women that have obesity will likely stop bleeding. But the fact you stop bleeding doesn't mean you can't get pregnant. On the contrary side, if you have underweight, you can also have problems with bleeding when you can also become pregnant. So women that are bigger or women that don't really have good body weight can also have the same problem. If you have excessive indulgence in exercise, excessively, you're a gym rat, you live in the gym pretty much 24 hours, and you have low body fat, you can also not have your bleeding, then you're ovulating, and you can become pregnant. Now, if you're constantly under chronic stress, our body doesn't do well under stress, including our reproductive system. So if you're currently under any form of stress, stress can make you to skip your period. Stress can make you to completely not bleed when you are ovulating. So anything that leads to stress, examination stress, sports, relationship, moving, or you're preparing for any exams, it can alter your whole body mechanisms. And you might not bleed, then you're ovulating and you can become pregnant. Some women might have a medical condition we call polycystic ovarian syndrome. Polycystic ovarian syndrome is a known cause of male infertility. One of the problems in polycystic ovarian syndrome is irregular or absent of your period. But some women can still release their eggs because they must still have that opportunity and they can become pregnant. Unfortunately, some women might have what we call primary ovarian insufficiency. So primary ovarian insufficiency simply means your ovaries have failed before age 40. So in primary ovarian insufficiency, you'll be having irregular or absent of your period. But some women can still be lucky to still ovulate, and within this time, they can become pregnant. If you generally have what we call hormonal imbalance. So hormonal imbalance simply means one of your key reproductive hormones are either higher or lower. Estrogen, progesterone, FSH, LH, they can alter your balance, and you might think you're not bleeding. Meanwhile, you've ovulated. Now, if you have some uterine problems, so there are some women that might have had some adhesions or some abnormalities, and they are bleeding internally. The bleeding is not coming out, but they are ovulating. So any of the uterine conditions can also lead to pregnancy because the bottom line, the common denominator in becoming pregnant is ovulation. So I want you to have it as a takeaway this afternoon. So long as you have not entered menopause, don't just focus on bleeding. Focus on ovulation. So if you feel you are not having all those classical symptoms of ovulation, don't assume. Go to a gynecologist. Once we confirm you are ovulating, we encourage you to make love regularly. The more you make love, the more you improve your chance of becoming pregnant naturally, even when you're not bleeding. So if you want to get pregnant and you notice you're not bleeding, please, we recommend you keep the rule of 6 months and 12 months. If you are above 35, please practice your PPP, for 6 months. If you're under 35, 12 months. So pray, play, practice. Pray to God, make love every other day or every day. If you're above 40, I want it to be every day. Then once that period expires, 6 months or 12 months, begin to seek help from a fertility specialist so we can get your fertility evaluation done on time. If you don't have any of the symptoms I mentioned and you notice you have not been bleeding for 3 months, that period is called amenorrhea. You need to seek help. So if you are not getting your periods, it's possible you're dealing with infertility. Don't assume, because Dr. Chudi said you can become pregnant when you're not having your bleeding, then I'm hoping against hopes. No. Scatter your seeds. Think outside the box. There might be other reasons why you guys are not conceiving. We also have to check the man and make sure it's not male infertility. So depending on the reason why you're not ovulating, depending on the reason why you're not bleeding, we can fix it. We can treat it. We can change your lifestyle. You can lose your body weight. You can add a lot of weight you need, and your body will improve and you can become pregnant. So you may also need special fertility treatment, including assisted reproductive technique. So take home today, whether you're bleeding or you're not bleeding, don't give up hopes. Pregnancy is still possible. That's my presentation. I'm not seeing anybody in the clinic, but it's okay. But I'm done with my presentation. Please, if you have any questions, feel free and ask your questions. Please, immediately after this clinic, I'm going to repeat this clinic in our Facebook page. So join me on our Facebook page, and we're going to have another repeat of this clinic. Start asking your questions. We're going to spend about next 5 minutes, then I close the clinic. Ask your questions. If you have any questions, feel free to ask, and I'll provide you feedbacks. Okay, so it looks like we don't have anybody in the clinic, but hopefully when you come back and you see this video, you will spend time, you will understand the video, and you will understand that despite the fact you're not bleeding, possibility of pregnancy happening naturally is high. So don't give up hopes. Keep on meeting with your partner regularly. Keep on avoiding stress. Work with your fertility specialist. Make sure you exercise appropriately. Eat the right kind of food. Be hopeful. Keep a positive mindset. Keep very positive friends. And always show up every day. No matter what happens, do your own best. And God will do the rest. Thank you so much for coming this evening. And I'll see you guys in our Facebook. Bye-bye for now.